commonly it's called pulse. And even in our local dialects, people call it cocoa, you know, yes. So it's basically, in short, swollen veins around the anal region. So there's something we call the anal cushions. So these anal cushions are usually filled with blood vessels, you know, and what they do is that they swell up or they contract to allow us to move our bowels. Okay, so when they become engorged and such that they become symptomatic, we say that we have bowels or we have hemorrhoids. So that's basically what hemorrhoids are. And it depends on where exactly it's located. We have different classifications of hemorrhoids where you see that we have the internal ones where you don't see them, but depending on the grade of it. And then also you have cases where you have the external ones. So the internal ones are basically found within the lower part of the rectum. So the rectum is part of the, the large intestine. Okay, so when you have it at the lower part of the rectum, where in certain cases, when it's not large enough and it hasn't prolapsed, you may not see it outside the body. But you may have some signs and symptoms that I'll talk about shortly. And then also the external ones where you may feel there's something hanging around the rim of the anus. Yeah. You get it. So those are the external ones. And the internal and external ones, there are differences in terms of even the signs and symptoms that they present with. The external ones, basically you may feel that there's something that is actually hanging out of my anus. And hemorrhoids, I mean, some people, because of where it is located, it's a very difficult and sensitive topic to talk about because people do not want to are shy and embarrassed to even talk about the fact that, oh, I found something somewhere, you know, in that private area. And then the internal ones usually are not painful, but they may present with bleeding. So anytime the person goes to the washroom, the blood is bright red and then it spills in the toilet bowl. Or certain times when they try to clean after using the washroom, they see that there's some blood on the toilet paper. Or there are certain times too when they finish, there's some dripping and the blood is not mixed with the stool. All of these are signs and symptoms associated with bowels. But having said this, I should also quickly mention that bleeding from the anus could also mean other things aside bowels. So it could mean, exactly, it could mean that it's maybe some cancer of some sort. Cancer in the colon or in the rectum, yes, or it could even be any other thing like inflammatory bowel disease. So you having maybe bright red bleeding, you shouldn't take it for granted, but rather quickly get to the hospital so that it can be investigated as soon as possible. So having spoken about the internal and external ones, the internal ones come in grades. So depending on how large it is and depending on whether it can be reduced back into the rectum or into the, back into the rectum, then you'll be able to tell whether it's grade 1, grade 2, grade 3 or grade 4. So grade 1 usually they are not prolapsed and you may have some bleeding associated with it depending on how large it is. And then grade 2, we say it's grade 2 when anytime you are moving your bowels, it prolapses, so it comes out and then spontaneously it goes back in, okay? But in certain times where it prolapses, but then you have to manually push it back in, that is grade 3, okay? And then in certain times where now it becomes constantly prolapsed or permanently prolapsed, then that's grade 4. So the grading is important because it also helps you know the type of treatments that you can give for each of these hemorrhoids. And I'm sure we've heard a lot about some of the myths associated with hemorrhoids. People say that, oh, as for bowels, it's just for the elderly, very old people, they're the ones, but no, it's not. It affects almost every age group, depending on the risk factors. If you do have some of these risk factors, yes, you would be able to have bowels, depending on anything that increases your intra-abdominal pressure. It predisposes you to having bowels. Also, people say that, oh, when you take in some spicy foods, they are the ones that will end up giving you piles. But that's not true. That's erroneous because what the spicy food will do is that, you know, when you are going to excrete or when you are going to pass to, if the area is inflamed and this spiciness gets close to people who already have the hemorrhoids, then they may end up having some burning sensation around the area. But spicy foods in themselves do not actually cause.
I'm sure another, major misconception or myth might be that they go away on its own.
Yes.
Or that is a truth.
Well, there is some truth in it because it depends on the grade, as I mentioned. So if it's in the early grade or in the early stage, it is diagnosed, and then you refrain from all the things that promotes its development. It's likely that it will shrink, and then that will be the end of it because they are non-conservative. So we have conservative and then non-conservative ways of managing. So once you notice it, then now you make sure that you are eating high fiber diets, and then you're hydrating appropriately. It means that all the risk factors have been reduced markedly, and it may end up shrinking. So that has a little bit of truth in it.
Can you walk us through the main causes of hemorrhoids?
Yes, so there are a lot of risk factors associated with developing hemorrhoids. One of them is anything that causes increased intra-abdominal pressure. So something like constipation. So having very hard stools that you have to strain as much as possible before you end up moving your bowels can predispose you to getting hemorrhoids. Another is micturition. So people who have maybe a large prostate and they have to strain before they are able to urinate or pee, that's another risk factor for developing it. You having or eating foods that are very low in fiber, so very refined foods, such that because the fiber, what it does is that it adds bulk to the stool, and then it also helps with absorbing water so that your stool is not dry. So if you have absence of this, it means that you may end up having very scanty stools and you would have to strain before you can move your bowels. Another risk factor is even pregnancy. So pregnancy, and then that would also lead to an increased intra-abdominal pressure, and then eventually you may end up with piles. And then having to sit on the toilets, yes, for very long periods. It's the same thing to increase pooling of the blood vessels around the anus and then around the rectum to lead to pooling of blood there. And then with increased gravity, that can lead to you developing piles as well.
Take our phone
yes,
and books to the
exactly.
toilet.
Yes,
so wrong. Wow.
Yeah. So all of these are some of the risk factors associated with hemorrhoids and then you developing it.
Would you say it's a life-threatening condition to have?
So yes and no. Yes, when it becomes complicated, and no when it is just at the early stages, you have been diagnosed and then you have to go on to do some lifestyle modifications to reduce your risk factors. In the sense that if you have piles that has become enlarged and it has become maybe thrombosed as well, and what is happening is that you end up bleeding. You are bleeding through these piles, so, or hemorrhoids. You are bleeding. So once you are bleeding, it means that anytime you try moving your bowels, you are losing some blood. This can lead to anemia and all of its associated risk factors or its complications, and that is when it becomes life-threatening, as opposed to the ones that they are small and the only maybe signs. And so maybe let's talk about even the signs and symptoms associated with it. So some of the signs and symptoms may be the bright red bleeding that I have spoken about, and if it goes on for a very long time, you end up with anemia. So anemia, you have all the signs associated with low blood levels or low HB. And then the other thing that may happen with it is that you may end up feeling that you have that feel of there's something hanging outside your anus, okay, which is not pleasant. There are certain times where, because of this, you have something we call incontinence. So the anus is supposed to, it's like a sphincter. So then it closes tightly so that things just don't come out. But then when things end up coming out without that, the fact that you yourself would have to allow it or relax it for it to come out, then you may end up having to sew your underpants and all of that. And then also the fact that when the area is wet, it means that there can be some superimposed infection of either bacteria, because already we know our stool has a lot of bacteria. So some bacteria may end up, you may end up having some skin changes and then skin infections around the anus, which will not be pleasant. Then also pruritus, there's something called pruritus ani, where you end up, because of the moist nature of the area and then superimposed infection plus the inflammation that is going on, you end up scratching the area. So you scratching the area will make it worse, more inflammation, more infection, and then also it makes it uncomfortable. So you may not be able to mingle well in social functions. Exactly, and all of that.
Moist,
and then, is it naturally moist? It's not naturally moist, but as I said, if it becomes prolapsed, it means that your anus that is supposed to must have been tight. Okay. There's something coming, yes, prolapsed. It's out of it. So it means that things that are coming from your GIT or your small intestine can sip out. Okay. So if it sips out, then it will keep that place very moist. Okay. And once there's moisture, if there's any bacteria or any virus there, you end up with a superimposed infection. And then the whole cycle continues, as we have mentioned. And then also the feeling of you have visited the loo, but then you still feel that there's something still there. So incomplete voiding is also another symptom that the patient may present with. So there are a number of symptoms. And then when it becomes complicated, you have your anemia, as we have mentioned. And then also there are times that people become uncomfortable because of the fact that they feel that there's something hanging out of their anus.
Every time you have, should I say, incomplete bowel
voiding,
or you still feel that you've retained some of your, does that mean, I didn't want to say poop, but does that mean that you have piles necessarily?
No, that can be other conditions, but then it's one of the classical symptoms and signs that the patient may complain of.
When do I know that it's time to visit a doctor?
Okay, so a number of them, especially when the fact that you are bleeding, you are bleeding continuously. So that will lead you to anemia with all the signs and symptoms associated with it. You become dizzy, you become weak, and all of that. Yes, you need to visit the hospital. And then also, when you have grade 3 and then grade 4, where in certain times now it has become bigger, that you would have to manually push it in. You may have to visit the hospital for the treatment options to be given to you. Or if it becomes permanently prolapsed, as in grade 4, then that as well, you need to visit the hospital for the necessary management to be done. So the management varies from conservative to non-surgical to surgical. So non-conservative or conservative, is basically where some lifestyle modifications would be prescribed to you. So it means that you have to consciously make sure that in your diet you have fruits and vegetables associated, or you have fruit and vegetable included in your diet. And then also high grain or high roughage should be within your diet as well. So people who like the white breads and all of that, now you would want to be eating the bread that contains wheat, that contains whole grains and all of that. And then you need to hydrate as much as possible, at least 3 liters of water. Make sure that you have hydrated. And then make sure, and then another thing I didn't mention is that One of the risk factors also that has been associated is the fact that people who use enemas, so the use of enemas, you know, in our local settings, yes, people end up using people end up using enemas, you know, harsh, yes, you know, and then
that's fine. That's fine.
You know, so then that's also, you need to avoid that.
Ginger. Yes. Wickedness in that.
You know, so you need to avoid that as well. And then after, so hydration, and then making sure that you are eating whole grains, and then aside that, you make sure that you do, there's something we call sit baths. So sit baths are where you are going to sit in some warm water with a little bit of salt. Okay, so what it does is that it has, the salt acts as an antiseptic, and then to kill any bacteria that is within the area, and then it also helps to shrink and then reduce the inflammation that is ongoing there. And then once you have taken care of all of these, it means that your stool consistency is going to change. So it would give you shorter periods within the when you are visiting the washroom, and then it will reduce the straining that you are going to be straining during that period. So once you have these and then you maintain it, yes, you should be able to adequately manage the beginnings of these hemorrhoids. And then if you are examined, and then it means that you would have to undergo certain non-surgical management modalities. Some of these include sclerotherapy, where sclerosants would be injected within it just to help shrink it, and then it is taking off. And then other times where you can use cryosurgery, so freezing. So instead of sclerosant, you can use low something that is so like nitrous oxide, for that particular procedure. Or you can do band ligation, so where a little rubber is used to tie and then allow it to wither, and then that's also takes care of it. So those are the non-surgical ways of.
You mentioned. Can women do it? Because salt and
yes, they can. They can. It's not hypertonic salt, you know. So it's just enough to taste like there's some salt. So it's not very.
So the salt shouldn't overpower.
Exactly. So just a little bit of salt in there, because the salt actually has that antiseptic agent to help with, and then it has to be measured so that you don't have to go in all in like that, but you know how to, so that it's more to the back than to the front. Yeah.
All right.
Look, I want.
And then the surgical,
Oh, you can finish your point then.
All right. And then the surgical management. So the surgical management, that will mean that you'd have to have some hemorrhoidectomies done. So where you'll be taken to theater, and then it is taken away. Surgical, by a surgical means, and then you are given some post-operative instructions and then management, and subsequently you should be fine.
The whole thing is removed?
Yes, the whole thing is removed.
And you can live without it?
Yes, you can. So it's just a swollen, engorged vein, which will just be taken. And usually these anal cushions that I mentioned, they are usually the sites where you find them will be at the number 3 o'clock position, number 7 o'clock position, and number 11 o'clock position. So most of the time, those are the areas that you may find all certain times.
There's a question here for you, Ju, just before you come in. Is itching around the anus a symptom?
Yes, it is. So pruritus A9, we mentioned it's because of incontinence, and then you have the place is moist, inflammation, spine-pose infection, all of that can lead to that, and then that becomes very uncomfortable for the patient. Right.
I wanted to talk to you or get your views around the prevalence of it.
Okay.
You know, because at the point you sit in any public bus transport, somebody's inside selling cocoa, medication. So just tell us how
common it is. It's actually common. It's actually very common. It affects, so it's something that can affect almost every age group. So there isn't any age predilection as I mentioned in one of the myths, where people think that, oh, it's just for the elderly. No, it's not.
Or obese people.
Or obese people. Well, obesity is a risk factor.
Okay.
But then it can affect almost everybody once you have these risk factors. And it's quite common because people would come in and some people, and you see, most people may not also present to the hospital because of how sensitive it is. And they may feel embarrassed to talk about that part of their body. So it is common. There are a few people who would present to the hospital, but most of the time, the records that will be in the hospitals will be the ones that come with the complications, because it has gotten to a part where if they do not take care, it becomes life-threatening.
Yeah.
But then imagine all the external ones, and then the ones that are maybe in grade 1 or grade 2 that are not presenting just because of the fact that they are not having all the complications that we've spoken about. Yes, there are a number, so it's quite common.
Yeah.
And people actually have it, especially because most of our diets, now people are moving away from vegetables and contemporaries and all of that, and rather they are eating all the fast foods.
Yeah.
Okay, the
very
Indomies,
oily,
you know, yes, and then the greasy foods and all of that. And all of these would increase our risk of developing piles because of the increased intra-abdominal pressures that we may end up having.
There's a question here from Kujo. He wants to know if eating too much okra causes koko.
No, so eating too much okra, no, it doesn't, because it's one of the vegetables that is recommended, and it helps you to free your bowels nicely, so it shouldn't. It's rather a good risk factor.
All right. I think the other question here you've already answered. Can constipation cause piles?
Yes, it is one of the main risk factors that leads to the formation of piles or hemorrhoids for that matter. Yeah, so those are, I mean, so in a nutshell, we've actually gone through what piles or hemorrhoids are. And you know, interesting, in one of the, what's the name? The myths as well. Aside people thinking it's for the elderly, and then it's spicy. Some people even think it's contagious. Yeah. Some people think that it's contagious.
Next to you, you're scratching your butt like, I'll excuse you. So, yeah.
Some people think that it's contagious, but it's not. Piles is not contagious. And the only thing is that you can have superimposed infection in the area.
Yeah.
So either bacteria or viruses, because of how moist the area is. So you can end up with an infection that will lead to the pruritus ani that we spoke about. So you sharing the same toilet bowl with somebody will not let you get piles.
What would you say you need to see a doctor? I mean, especially for the mild cases, right?
Yeah.
At what point do you say, you know, you've got to get this checked?
Exactly. So in people who have started lifestyle modifications, but then they are not seeing any regression, but they are seeing some progression. Possibly, maybe the first time I only had the internal one, some bleeding, it wasn't prolapsed. But then subsequently, I started my lifestyle modification. But subsequently, I noticed that that same pile, it hasn't reduced in size, it has rather become bigger. And now it's prolapses and it spontaneously goes in. So it means that it is progressing. So you definitely have to come for a thorough assessment to be done. And especially in people who maybe they have the bright red bleeding and they haven't been screened for other diseases like the colon cancers that I mentioned or the inflammatory bowel disease. Yes, all of these are very important that you come so that they are ruled out and then you are treated appropriately for the condition.
What advice do you have for, let's say, someone who may be going through any of the symptoms that you mentioned?
Yeah.
But you know, it's a topic that people shy away from. They're too shy to, you know, talk about it. What advice would you have for someone like that?
Yeah. So what I would say is that it's important. I mean, your health first. Once you have life, and you have health. That's the most important thing. So you need to put aside that shyness, yes, as much as possible. And then talk to any of your primary healthcare physicians about it. And the appropriate management will definitely be given you.
There's another question here. Good morning. What is the cause of hard stool?
Hard stool. Okay, so
is that
hard
constipation?
stool, yes, that's constipation.
Yeah, that's constipation.
So hard stool is when you are not eating the raffages that I mentioned. Where do you get raffages from? You get raffages from your vegetables, so inclusion of vegetables and then fruits in your diet. So raffage, you don't digest raffage. We humans can't digest raffage. So they definitely would have to come out through us. So they give us bulk. They increase the bulk of our stool. And aside the increase in bulk of our stool, it also helps to absorb water, okay, so that your stool is not dry and then it can come out. Once you have bulk, you have some moisture in the stool, it can easily pass out instead of it being scanty and then very hard and you do not have water in there. And then eventually, even when you have to strain, you have to really strain to get it out. And through that, if it is very hard, it can end up causing some scratches along the whole canal, and then that can also predispose you to certain.
What is the correct way of passing stool? I've been told that you should set your feet on, elevate it a little so that it's easier.
Yeah, it's easier. So all of this is to help you reduce that intra-abdominal pressure, because that's the most. So once you do that, research has shown that once you elevate your feet and then your knees are well bent, it reduces that intra-abdominal pressure that we are talking about. So if you are sitting at 90 degrees, it means that it will increase the intra-abdominal pressure, the strain would increase that intra-abdominal pressure, and then they'll be pulling the blood vessels or the cushions at the anal region at the lowermost point. So it will increase that pooling of blood there with the gravity acting on it, and that can predispose you to get it.
I've always wondered why they don't make toilets in that way, because it's easier, to be honest. You should elevate your legs and poo. And pass. So, okay, there are questions here. Okay. Good. Is waist pain a symptom of piles?
No, it's not. It's not a classic symptom of bowel. It's just one of those musculoskeletal pains. But not a classic.
Wants to know if it is hereditary, because they say, I have some, and I asked my grandma, and surprisingly, she said it's in the family.
Yes, so familiarly, yes, some people who have some...
of all the things you can inherit.
I know, right?
But you see, all of these that you have some genetic predisposition and all of that, if you indulge in the right practices, it reduces your risk.
Okay.
But then if you do have family history of it, you need to indulge in the right so that you don't end up having. So it puts you at a higher risk of getting hemorrhoids compared to others who do not have it at all.
Kojo from Adan wants to know if cocoa causes impotency.
No, it doesn't cause impotency.
Why are you laughing? Is it like a myth bust? Is this like something you hear often?
Yes, I've heard about it before. That cocoa, and even people say cocoa in your eyes.
Oh, how?
Yeah, they say cocoa, so it gives you what, blurred vision and all of that. Yeah. So people are
a major culprit of these kinds of stereotypes and misconception will probably be all of these drug sellers. I don't call them peddlers, but
on the bus.
On the bus,
it's like, they claim their medication can solve every. I mean, the main target is cocoa. Yeah. But then they go on to say cocoa. It can solve every other thing. So it gives me the inclination that it is a very common, because people buy. Like you say, the church, I go get free. People are buying it.